Hi guys, I'm Dr. Tara Tobias. I want to welcome you all back to this channel. In today's video tutorial, we are going to go over pain. Now, I talk a little bit about pain in a lot of videos, especially when it comes to a structural problem that can happen after a stroke or a movement problem that can happen after a stroke. But today what we're going to do is just address pain in general. What causes pain? Why is pain so prevalent after a stroke? And what do you do if it's not related to a structural problem or a movement problem? As well as, and most importantly, is how do you prevent pain from turning into a problem that significantly impacts your rehab and your progress towards your goals. But before we dive into that, if you're new to my channel and you haven't yet subscribed, go ahead and hit that subscribe button, turn on that notification bell so that you'll be notified every time I upload new videos. I upload videos every week just to teach you and educate you and help you to take a little bit more control and a little bit more ownership over your rehab, and hopefully be just another tool in your bag of tricks to get you to your goals of greater independence, better movement, and just a happier, healthier life. So now let's go ahead and dive into the content of this video. So pain. If you're someone that's dealing with pain or experiencing pain, you know how frustrating and discouraging it can be when you're trying to progress towards your goals and you have this pain in the way that's interfering with your progress. Now, it's easy when we can trace it back to a structural problem or a movement problem, address that structural problem or movement problem, and you continue on your way, you break through that barrier, and you're able to continue on in your journey. But what happens if that isn't the case and you can't trace it back, or your therapist or your doctor can't trace it back to a specific structural or movement problem? What else could be going on? Well, there are two major pain conditions that are pretty common after a stroke, and they're oftentimes missed, and therefore your pain might not get treated appropriately, and therefore that might be why your pain is persisting. So today we're going to go over those two conditions, and those are central post-stroke pain and complex regional pain syndrome. So first let's talk about central post-stroke pain. So central post-stroke pain is pain that is caused by a lesion in one of the areas that is associated with the pain circuitry in the brain. That's why it's called central post-stroke pain, because the cause is coming from the brain. Usually people will describe the pain as burning, aching, throbbing, sharp, stabbing, and it's not really related to any type of a stimulus that would warrant that type of a sensation or that type of a feeling. At best guess, the theory is that when there is a lesion in the thalamus, which is one of the areas that is part of that pain circuitry, there is a compensation or an overreaction of the thalamus due to that damage that creates like hyperstimulation in that area, which in turn is interpreted as a more severe pain without a known cause. And usually this is diagnosed by process of elimination, meaning that they'll rule everything out and then they will come up with this as being the cause of your pain. Now, I have seen some doctors that will look at your MRI, see where your stroke was, if it was in the thalamus, and then just start treating it appropriately, assuming that it is probably thalamic pain, if your presentation and the way you're describing the pain fits that description that I gave earlier. But when I reviewed a couple of articles, they still consider it that the main way to diagnose it is to rule everything else out. And what I know from my experience is that it's extremely frustrating for patients. So if this is something that you are dealing with, just hang in there. I have definitely seen patients respond to treatment for this, and just know that you're not alone, you're not making it up, you're not crazy, and that there is a legitimate cause to your pain. It just happens to be neurologic and therefore might have gotten missed. But the main treatment for it that I've seen work is really just a combination of medications. The best doctor that I would recommend going to is a physiatrist or a physical medicine and rehab doctor. They seem to be the best at understanding where this pain is coming from and how to manage it. But even in that case, and going to a physiatrist, what I see is that it's really just trial and error, trialing different combinations of medications until they find something that works for you. I don't really think, in my experience, that I've seen like a consistent theme of these specific medications definitely help to minimize thalamic pain, but I highly encourage anyone who thinks they might be dealing with this type of pain and you're not getting any relief from your current treatments to maybe consider adding a physiatrist into your, I'm sure now, team of doctors to get this under control so that you can benefit and get the most out of your rehab. And then the other pain condition that I mentioned earlier is complex regional pain syndrome. And complex regional pain syndrome is a hypersensitivity of your sympathetic nervous system. Your sympathetic nervous system is that flight or fight system, our protective system. So when we experience pain or we feel something that's threatening, we either fight, get rid of it, whatever it is, fight it off, or we flee, we run. So you got your hand close to a hot stove, you would automatically withdraw your hand. That is that flight or fight, and that is overactive. So you're getting that flight or fight response with things that aren't necessarily dangerous or potentially dangerous to your body. So for instance, if I touched your uninvolved arm and that didn't cause any type of a negative reaction or didn't create any type of a discomfort, and then I did that same touch on the involved arm, you would feel that discomfort and you would jump or have some type of a negative reaction because that same touch on the involved arm was uncomfortable. And listen, you are not alone. This is really common and it can be extremely frustrating. But of the two pain conditions that I'm talking about today, this one is probably the one that responds a little bit better to treatment. So I hope that gives you a little bit of hope. If you are having this hypersensitivity, there is hope. If you are in this category and you feel like this describes your pain. Now, the number one way to not experience complex regional pain syndrome is prevention. So some of the things that can contribute to developing this type of a pain syndrome is not moving the arm, so doing passive range of motion early, and I'll put a link for a video in the description below where I go through passive range of motion for the shoulder, and then protecting the arm. So a lot of times this type of a pain syndrome does have like an initial trigger, such as someone pulling on an unstable arm or shoulder. I've also done a video on that, so I'll put a link for that video as well in the description below. So the best way to not experience this type of pain is to prevent it from happening in the first place. Now, if you are experiencing this type of pain, some of the treatment strategies that work are desensitization strategies, which I haven't done a video on yet. So if there's a lot of you that comment below that you do have this type of pain, I might do a whole video on desensitization strategies, but you want to basically desensitize that arm so it's not so sensitive to these things that normally wouldn't cause pain. So basically you start getting the arm used to touch and wind and hot and cold so that eventually it just adapts and that does not trigger a pain response. The other thing that's been found effective is mirror box therapy. So I've written a blog on mirror box therapy and how it can help with movement, and I'll put a link to that blog in the description below. So basically the way mirror box therapy works, or mirror therapy, is that you put a mirror to reflect your uninvolved arm and you go through exercises. And simplified, what you're doing is you're basically tricking the brain to think that you're moving your involved arm and yet not experiencing pain. So that's a very simplified explanation of the rationale behind that treatment, but it does work. So it is effective. It's effective with a variety of pain conditions, but definitely for CRPS. And then again, just like central post-stroke pain, there are some medications that can help with this. Again, I would refer you to a physiatrist. I think they're the best medical doctor in helping to come up with the best cocktail to help you get some relief from this type of pain. But I can't stress enough that with CRPS, it's probably going to get worse before it gets better, meaning you really do have to start reintroducing that arm to those movements or those stimuli that are causing that pain to desensitize that arm. So definitely want a physical therapist on board, definitely want a physiatrist on board. Best case scenario is that your physiatrist and your physical therapist are in constant communication with each other to help come up with the best treatment plan for you. And just, I can't stress it enough, before we end this video, if you're dealing with pain, just know that your pain is real And anyone that tells you that your pain is not real, find another healthcare professional, because you deserve answers. Now, that's not to mean that you're going to be pain-free when you find that healthcare professional. As I mentioned earlier, you might get worse before you get better as far as the pain, but don't let that discourage you. Find a healthcare team that you trust and that you know that their ultimate goal is to help you get some relief from your pain. And again, I can't stress this enough, it's not well understood, and there is a trial and error period with most pain management treatments. So as long as your healthcare practitioner or your healthcare provider is just not giving up on you and they keep working with you and trying different things, that, in my opinion, is a sign of someone who is working with you and really wants to help you. So stick with it. If you are someone that's experiencing pain, go ahead and put it in the comments below. You never know how your story might be able to help someone else who's in this community. So I encourage you, share your experiences below. If you had pain and now you don't, definitely share those experiences as well. That will definitely give some other people a little bit of hope that there is answers and there is a solution and there is relief in their future. And then that is it for this video. If you haven't yet subscribed, go ahead and hit that subscribe button, turn on that notification bell so that you'll be notified every time I upload new videos. If you haven't signed up for my newsletter yet, the link is in the description below. I encourage you to sign up for that. I send out just emails just to connect with you throughout the week and help to motivate you and encourage you in your rehab journey. If you haven't checked out the new website yet, head over to www.rehabhq, where I have tons of exercises just to help you enhance your rehab, as well as a deeper dive into some cheap products that you can use at home to enhance your rehab. And then again, I know I always say this twice at the end of the video, but that is it for this video. I enjoyed spending time with you all today, and I hope you all have a wonderful day.